Hello! This video today is for you if you are a dentist working abroad and you need to use English with your patients, or a patient going to the dentist abroad. I think it's going to be very, very helpful, especially this video is especially aimed to help dentists working abroad, but I think it's going to help you as a patient as well to understand some things they might say to you in a consultation. So it was a lovely follower, Marcelli, who asked me to record this video, and so here I am. Right, I'm looking at my notes because I don't want to forget anything. So you arrive at the dentist's clinic, at the specific office. And the first thing the dentist might say to you, obviously, hello there, good morning, or hi, good afternoon. Would you like to come in? Would you like to come in? In English, you will notice that sometimes people ask you questions that they kind of know the answer to. It's almost a bit weird, but it's very normal in English. So, would you like to come in? Of course I would like to come in, that's why I'm here. But it's just the way they communicate, which is very important for you to notice because it's not your language, you are not a native speaker. And when you start to notice those tiny nuances, details, things start to fall into place and your speaking sounds a lot more natural. So, hello there, would you like to come through or would you like to come in? Then you will take a seat and they will have a quick chat before they look at your teeth. And when you sit down to have a chat, they will probably ask you, what can I do for you today? What can I do for you today? Or, which sounds lovely as well, what brings you here today? What brings you here today? The dentist is then expecting you to explain the reason for your visit. Let's just focus on the dentist's point of view for today, otherwise it's going to be a super long video. Right, you will explain what the situation is and the dentist might then ask you, how long has that been going on? How long has that been going on? So if it's pain, if it's discomfort, if it's sensitivity, anything like that, how long has that been going on? A very important question that you're probably going to hear if you go to the dentist with a specific problem. If you wear braces on your teeth, you know, the metal braces to make your teeth nice and straight. My teeth are very straight. I had braces for 10 years. There you go. They might ask you, do you have any broken brackets? Brackets are the little things. Do you have any broken brackets? They might ask you, do you have any broken or loose brackets? Loose because it's moving a little bit, right? So the glue is kind of not sticking anymore. Do you have any broken or loose brackets? Loose, it's a strong S there, okay? And they might ask you as well, anything bothering you? Anything bothering you? You don't need to say, is anything bothering you? You can just say, anything bothering you? It's absolutely fine. It's just a very informal conversation. After this brief talk, the dentist is going to ask you to go to the lovely chair, which then you might say as a dentist, all right, let's get you on the chair so we can have a look. Let's get you on the chair so we can have a look. Sounds supernatural and lovely. So the dentist's chair is that kind of chair that you can move up and down, and it's a bit of a funny chair, isn't it? So if you're going to put the chair back, you might want to tell your patient, you might want to say, I'm just going to put the chair back a bit, and then you do it. I'm just going to put the chair back a bit. Or you might want to say, I'm just going to raise your chair a bit. Raise your chair, because you can do that too, can't you? So cool. So I'm just going to put your chair back a bit, and I'm just going to raise your chair a bit. Sometimes when the patient lies down, they're not really lying properly. So they need to move up a little bit for their head to be on the right place for you to be able to do the checkup and everything. In that case, you will say, Could you just move up a little bit? Could you just move up a little bit, please? Right, when you start looking and using your tools, you might want to check that everything is okay with the patient. A nice way to say that is, how's that? How's that? So you're using your little tools and maybe you're tapping on the teeth. They do that as well, that you can even say that. I'm just going to tap when you do this, right? I'm just going to tap your teeth gently with my mirror, and you'll let me know if it feels a bit tender. A bit tender. It's not exactly painful, but it's like a bit painful. So I'm going to tap your teeth with my mirror and just let me know if it feels a bit tender. And then you do it. And then if you want to check that everything is okay, you say, how's that? Okay, how's that? And wait for your patient to report back. If you want your patient to open their mouth a bit bigger, you say, open wide, please. Open wide. Sometimes you need the patient to turn their heads a little bit. In that case, you say, turn your head to the left a bit, please. Turn your head to the right a bit, please. After you've done everything and you've used your tools, the patient has got water and a bit of spit, sometimes blood, in their mouth, and they need to rinse it out. So you'll say to them, you can sit up and have a rinse out. Have a rinse out. Sometimes there's a bit of water or something there in a cup. They'll put it in their mouth and they'll have a rinse out. Rinse it with the water. Rinse it with the water and spit it out in the basin. In the basin, you know, the little thing that you have there in your dentist's office. So spit it out in the basin. Sometimes you need your patient to do this. You say, bite together for me, please. Bite together for me. If your patient has had anesthesia and is not feeling anything, you might want to say, be careful not to bite yourself whilst it's still asleep. You can say that it's asleep because it's numb and the patient's not going to be able to feel anything because of the anesthesia. So you just say, careful not to bite yourself whilst it's still asleep. And of course, you finish your consultation making sure the patient is okay. Is everything okay? Are you feeling okay? Brilliant. How was it today for you? Making sure that the patient is not traumatized or anything like that. And then you can just give the specific recommendations you have for that particular patient. So I'll need to see you again in 2 weeks' time, or I'll need to see you again in 6 months for a cleaning or anything like that. But I hope this video has helped all dentists out there working abroad and sometimes struggling with the really simple things that we have to say, not we, but that you have to say to patients on a daily basis. So leave me a comment if you would like a video about any other job that you might do abroad that you feel you're struggling to say the really basic and simple things in your day-to-day. All right, thank you for being here with me today. See you all next week. Bye.